From NBC News, this is Today with Lester Holt and Amy Robach, live from Studio 1A in Rockefeller Plaza.
All right, Bill, thanks. This morning, an NBC News investigation on health care in America and how difficult it is for many Americans to get approval for medical tests from their insurance companies. NBC's senior investigative correspondent Lisa Myers has more.
Right to you.
A little over a year ago, 46-year-old Mike Fields went to the doctor, complaining of pressure in his chest, extreme fatigue, shortness of breath.
I had a real bad feeling there was something wrong, something bad.
His doctor sent him to get a nuclear cardiac stress test. Radioactive material is injected into the heart to assess blood flow. But Fields' insurance company, Blue Cross Blue Shield of Delaware, denied approval of the test 3 times.
What were you told?
I was told the letter stated that they didn't deem it necessary.
Recorded calls show Fields' doctor's staff pleaded for approval.
I'm at a total loss. This guy needs a stress test or he's going to drop that.
Finally, Fields' exasperated doctor sent him to the hospital, where Dr. Andrew Dorey found a key blood vessel almost completely blocked.
Is this considered a serious heart problem?
Oh, yeah. I mean, this is about as serious as you get, because if this closes, your heart is basically gone.
The next day, Fields had an emergency quadruple heart bypass.
Yeah, and if Mike Fields had not come to this hospital?
He wouldn't be alive today, guaranteed.
The decision to deny the test actually was made by a company called Med Solutions, hired by the insurer to pre-approve medical tests. The company works for insurers nationwide and boasts that it can cut costs 25 to 30%. A Senate investigation of Med Solutions cases in Delaware found some denials were warranted, but that a significant number of medically necessary nuclear stress tests were denied inappropriately. About 10 to 15% of all tests. Senator Jay Rockefeller says it's an industry strategy.
It's absolutely deliberate. It's what they've always done. The more they say no, the more money they make.
In fact, Delaware's insurance commissioner reported that under the contract, Med Solutions fees were to be cut if it didn't save Blue Cross 20% or more. Med Solutions disputes the Senate's findings and argues that cardiologists overuse these tests, often because they have a financial interest. The company says its guidelines ensure that patients receive the right tests at the right time. At no point ever is any criteria considered that doesn't put quality and safety patient care first. Both Med Solutions and Blue Cross say they can't comment on the Fields case because of privacy laws. Blue Cross says it has since changed procedures and no longer requires pre-approval of nuclear stress tests. Machines for these tests are made by Philips, Siemens, and General Electric, a part owner of NBC Universal. Fields still has not gotten over the desperation he felt last year.
I knew something was wrong with me. I knew it. I didn't know what to do.
But he considers himself lucky to be alive and treasures time with his son even more.
Ready?
For Today, Lisa Myers, NBC News, Newark, Delaware.
Andrew Rubin of New York University Langone Medical Center is the host of Healthcare Connect on Sirius XM Radio. He joins us now from NBC affiliate WSDU in New Orleans. Andrew, good morning. Thanks for being with us.
Good morning, Lester.
You've got a lot of experience dealing with this sort of thing. Is that typical, what we just saw in that story, for a denial on a procedure like that?
It happens every day. It doesn't just happen with nuclear cardiac stress tests, but you need to step back, Lester. These companies are hired to look at utilization of certain testing, tests that are done around the country, and this is what they're supposed to be doing. Is
it more likely than not that when a first request goes in, it is denied? Is that fairly standard?
No, I don't think that's not necessarily true. What happens is the physician or the doctor's office needs to explain to the insurance company, in this case a third-party vendor, what the reason for the test is. If they don't meet the criteria that's established by the insurance company, they may then be denied. But usually physician offices have the criteria and know what it is that gets a test approved. However, as you can see, sometimes that process does not work.
There are certainly two sides of the story, and the other side being that health care costs are going through the roof. So where's the balance? How do the companies find the balance with the doctors?
It's an impossible balance to find. You really just need to make sure you're prepared for this when it in fact happens, because again, you heard 10 to 15% of the tests were denied inappropriately. So the doctor's office and the patient importantly, needs to know what to do when, in fact, the test gets denied.
Well, equip us with that knowledge. What do we do if a doctor says, look, you need this test, the insurance company denies it? As the patient, what's my next step?
You immediately call your insurance company and appeal the decision. So there's a process when you buy insurance. You have the health care insurance, and you're entitled to an immediate appeal. So you want to call the insurance company and get that appeal process going.
But you need the doctor as your ally as well, correct?
The doctor is the best ally here. The doctors are, and again, the doctors know how to do this because it happens all the time now with all these tests. And there's more and more tests in this country every day. New technologies come out. We're going to be hearing about this a lot. The doctor gets on the phone. Their office gets on the phone. They frequently will call the medical director at these insurance companies and plead their case. The problem is it's time consuming and the doctors get busy. So the patient really is the center here and needs to make sure that the physician is advocating for this test on their behalf.
Bottom line is do not give up. Andrew Rubin, thanks so much for being with us this morning. We appreciate it.
Yeah, don't give up, Lester.